Thank you very much, Olivia. Hello. I'm very honored to be here as part of this conference. Uh, this is my second time. I would like to honestly say that it's very good opportunity to debate on important issue. Thank you very much. I would like to thank organizers, especially CESRAN teams, and especially Professor Rahman Dak. I will try to start my presentation. Okay. One moment, please. Okay. Uh, I'm sorry, I have to turn off my camera. I think it will be better for my internet connection. One moment, please. Okay. Okay. I hope everything is okay. Uh, I'm also grateful to my that our university can participate of this conference the second time. My topic is very difficult because war is terrible, terrible for people, for those, sorry, for those who died and for those who remain to remember them. Many of them require medical assistance for their body and their soul. The Russian attack on Ukraine in February 2022 was continuation of the aggression from 2014. It was a disruption of the regional security order, the regional order that we created in Europe after the Cold War. Of course, I will not talk about it in detail, but it is one of the important building blocks for building a new world order. And this is what this conference is about. Professor Richard Wu and Professor Louis Thoma also talk about it at the inauguration. They spoke very interestingly and very inspiringly. But of course, this is not my topic. I would like to thank the organizers for the opportunity to share some reflections and data concerning the impact of the war in Ukraine on its healthcare system and the role of the European Union in supporting public health both within Ukraine and among the Ukrainian refugees. The topic I will present is very important, not only in the context of the war, but also in understanding resilience and solidarity in the European health system. War creates serious challenges for health institutions. It limits access to treatment and medicine and changes how people perceive their own health. War affects both physical and mental health. This problem influences people who live in the war zones, but also those who flee, including healthcare workers. When doctors and nurses leave the country, the ability of the health system to function becomes weaker, of course. Another serious effect of war is the interruption of prevention programs. delays in diagnosis, or stopping therapy. This can reduce the chance of recovery and even lead to death. In some cases, the type of weapons used during the war can cause specific disease in the future. So, the health consequences of war are long-term and may stay for many years after the fighting ends. The war has also made it difficult to get medicines in Ukraine. Prices increased and many drugs disappeared from pharmacies, especially for people with chronic disease. In 2022, the Ukrainian government changed the law to reduce the import of medicine from Russia and Belarus. It was a big problem. Ukraine also introduced electronic prescription for antibiotics and gave pharmacists new responsibilities, such as helping with vaccinations. One of the biggest problems is the growing shortage of medical staff. Many have died, been injured, or left the country. Often they do not return. As a result, medical staff still in Ukraine face more work and pressure, often without enough equipment, medicine, blood, electricity, and fuel. Of course, this affects their health and well-being. Even before the full-scale war, the average life expectancy in Ukraine was much lower than EU average. In 2019, it was 73.4 years, compared to 81.3 years in the EU. This means that Ukraine was behind other countries in health outcomes even before the war started. According to available data, the war has caused major losses in Ukraine's healthcare system. The United Nations has documented 1,682 attacks on healthcare infrastructures, including 84 ambulances and 699 hospitals destroyed. Nearly 200 healthcare workers have died and 137 were injured. Unfortunately, these numbers are not final and will probably increase while the war continues. Access to healthcare is especially difficult for Ukrainians living in areas occupied by Russia. As described in the article, Russia's denial of healthcare as a weapon of war, people are often forced to accept Russian citizenship, including medical workers. This situation limits access to medical help and creates ethical problems. Since the beginning of the full-scale attack in 2022, the European Union, USA, UK, and their allies strongly condemned Russia's aggression and introduced sanctions. They also started supporting Ukraine politically, economically, and militarily. Healthcare and humanitarian aid were part of this assistance. Over 6.3 million Ukrainian refugees were officially registered in Europe. Most were in Germany, over 1.16 million, and Poland, about 1 million people. The majority of refugees were women and children. As you can see, this is a cover of our book at our university, together with Dr. Joanna Lubimov and Lukas Budzyński. We published a book about Ukrainian refugees in our city. The title in English is Ukrainian Refugees in Their Own Words. And part of this book includes stories told by Ukrainian women about the war and the difficult experience of leaving their country. Since the beginning, one important challenge in healthcare support for refugees was the difference in vaccination programs and general epidemiological conditions. Many refugees had a higher risk of diseases such as measles, HIV, or tuberculosis. Antibiotic resistance and low vaccination rates, especially among children, were serious concerns. In many EU countries, refugee groups had higher disease rates than the general population. Of course, mental health support, especially for war trauma, was often not available in a sufficient quantity. As you can see in the table, there were big differences between EU countries in terms of how much their healthcare system were affected by refugees inflow. Central and Eastern European countries received the most refugees per 1,000 people, especially Czech Republic, Poland, and Estonia. Many of these countries had health indicators below the EU average. For example, life expectancy and healthy life expectancy were lower in Poland, Estonia, and Latvia. Mortality rates for cardiovascular diseases and cancer were also higher. Only Germany, on this chart, was above the EU average in preventable and treatable mortality. In terms of medical workforce, the number of doctors and nurses for 1,000 people was above the EU average only in Germany and Czech Republic. For diagnostic tools like MRI, CT, or PET, only Germany and Latvia were above average. This shows that Germany and Czech Republic were better prepared to handle the medical needs of refugees compared to countries like Poland and Estonia. There were, EU legal and organizational instruments. The support for Ukrainian refugees in the health sector was possible thanks to existing EU legal tools. The first important act was the Council implementing decision of 4th March 2022, which introduced temporary protection for people fleeing Ukraine. This protection gave refugees the right to stay, access healthcare, education, social support, and legal assistance in EU countries. It also ensured special help for unaccompanied minors and victims of violence. Another key mechanism was an integrated political crisis response, IPCR, activated on 27 February 2022. It allowed fast coordinated EU response through better information sharing, crisis meeting, quick decision on aid and sanctions, and real-time situation analysis. In March 2022, European Commission presented a special plan to support member states in the situation. The plan included a registration platform, coordinated transport and relocation, a crisis plan for unaccompanied children, anti-trafficking action, extra support for Moldova, better cooperation with international partners, and reinforcement of Frontex, Europol, and EU asylum agencies. Another important tool was the Union Civil Protection Mechanism. Between 2022 and 2024, the EU and its member states provided 3.7 billion euros in humanitarian aid, including food, water, medicine, shelter, education, and financial support. In March 2022, rescue logistics centers were created in Poland, Romania, and Slovakia. The first EU medical evacuation, MEDEVAC, mission happened on 13th March 2022. In September 2022, the EU MEDEVAC hub in Rzeszów, in Poland, was opened, providing 24/7 medical and psychological care before patients were transferred to other European countries. So far, around 1,700 people have received help through this system. The EU for Health program allowed Ukraine to become associated with EU health policy. Ukraine officially joined the program in July 2022. The first focus was on mental health and psychosocial support for displaced people. War refugees experience strong stress due to loss, pain, and violence. A 2023 study among Ukrainian teenagers showed 35% had trauma symptoms, 32% had moderate or severe depression, 29.5% had signs of eating disorder, 20.5 were at risk of addiction, 17.9% had serious anxiety symptoms. The EU Health program founded 4 main projects. Peace of mind, while you rise and measure. Peace of mind aimed to support mental health of 1,600 refugees and train 7,000 refugees and train 700 professionals, especially Ukrainian and Russian speaking. Well, you focused on helping refugee children and their caregivers in Italy, Greece, Hungary, and Romania, and train non-mental health staff and promoted awareness. EURISE created a network of Ukrainian Russian-speaking mental health experts and promoted e-health tools across Europe. Measure supported displaced people using the I Fight Depression application in Poland, Estonia, Germany, Bulgaria, Greece, and Hungary. It aimed to reduce the burden on healthcare system and share good practices. In June 2023, the European Commission and Ukraine signed a health cooperation agreement. It builds on earlier effort and supports Ukraine's long-term health development goals as part of the country path toward EU accession. The priority areas were identified: mental health and psychosocial support, especially for children affected by war, both in Ukraine and among refugees in the EU. And access to specialized rehabilitation. It was a key goal. The second, access to healthcare for refugees with temporary protection, including removing legal and administrative barriers and training healthcare workers to work with refugees. It also focused on integrating displaced Ukrainian health professionals into EU systems and improving access to vaccinations and health information. Third, repatriation and reintegration of Ukrainian patients, especially those treated abroad through Medivac. A special task force involving 19 EU countries coordinates this process. Fourth, priority in health needs assessment for Ukrainian refugees, coordinated by the EU's HERA agency with World Health Organization, UNICEF, Gavi, and the Global Fund. The focus includes childhood vaccination, treatment of tuberculosis, HIV, and COVID-19. The EU also supports Ukraine with access to medical products and may include Ukraine in the joint procurement agreement. And 5, support for rare disease care in Ukraine, including cooperation with European reference networks, and continued aid for the Rare Disease Center in Kiev's Okhmadrid Children's Hospital. And 6th priority is the continued funding of EU for Health project for Ukraine. And conclusions. The EU's support for Ukraine in the health sector is not only about solving short-term problems caused by the war. It is also about building long-term resilience and integrating Ukraine into European health structures. While emergency support, such as financial aid, evacuation, or psychological care, in essential cooperation through programs like EU for Health, shows a deeper strategy. It helps strengthen Ukraine's health system, making it more resilient in the future. According to resilience theory, supporting weak areas during crisis can improve long-term stability and performance. Furthermore, topics like cancer care or rare disease treatment go beyond the war context. They are part of a functional integration of Ukraine with the EU. These actions support Ukraine's EU accession process and shows that health is also a part of security and global cooperation. Thank you very much for your attention. I hope I have not prolonged my speech too much. Thank you.